because you and I have a lot to learn on how to have better sex starting tonight. He's just thought about foreplay kind of as a warm up, getting yourself in the mood. But when you all of a sudden said your cervix moves out of the way to get ready so that your vagina can double in length and width, I'm like, holy cow, there's a whole lot going on that takes a little bit of time, which is why it makes it even more important in some cases to really open yourself up to the play and to give your body the chance to even relax into it so you can enjoy it.
Absolutely.
And is that length of time different for men typically?
So men, it's sort of very binary. They get an erection or they don't, right? And so that is not always the only sign that they're going to have with arousal. You'll also see both men and women will have nipples sort of become more erect. There's other signs as well, but very often they're seeing the manifestation of that increased blood flow through penile erection. Now, in women, the homologue is their clitoris gets erect.
The homologue? What is that?
A homologue is essentially when you have two structures that are, made from the same embryologic tissues, and then they develop, into their variety of structures. So in men and women, you start off with a genital bud, and this in men becomes the penis, and in women becomes the clitoris. So they are exactly identical. If you cut open an anatomical, an anatomical visual of the penis and the clitoris, they're identical.
Really?
They're identical. They have two bodies of erectile tissue, two spongy bodies that fill and engorge with blood. They look exactly the same.
That's wild.
Yeah. So that's why I mentioned earlier, looking at your own body with a mirror. So one, it's also so that you can, if something is abnormal, you can see it, right? Because sometimes people will have skin conditions and they won't know. They've never looked down there, right? So that's one reason.
If we were to take a mirror and take a look at ourselves, what are we looking for?
Yeah. So I think ultimately, go online and take a picture of, type in vulvar anatomy, okay?
Vulvar?
Yeah.
There's an R in it?
Yeah. It's the vulvar anatomy.
Okay.
But anyway, so from the outside in, the first thing you're going to see is your labia majora. So those are sort of like the large lips of the vagina. Then you're going to go and you're going to see your labia minora. And so just look at the size, look at what they look like. Of course, make sure there's nothing abnormal, like you don't see a mole or something weird there that you've never seen before. But just so you know what they look like, right? Look at the clitoris, follow it up, look at the clitoris, pull back the clitoral hood gently and see if you can pull it back. Take a look at the clitoris and then look at the urethra, which is underneath and on top of the vagina. Make sure it looks normal to you. I mean, again, you don't know. Everyone looks a little bit different, but get a baseline of what you look like, and then look at the vaginal canal. It should be pink, supple, healthy looking, right? And then you should sort of get a sense of what you're looking at. And then you could also see sort of just what the size is, what it looks like. Just again, everyone's different. And if you look at, there's actually websites where you can look at labia. A lot of people get worried about are my labia too long or do they look too weird? But you can see all different shapes and sizes. It's very unique to you. You can see one's longer than the other. Some are long, some are short. And that's completely normal. Nothing to be ashamed of, nothing to worry about. And just sort of knowing what you look like is empowering you because again, like I said, if something changes, you can go back and look again and just say what is something different from what I remember.
So Dr. Rena, I think we all know that there's different types of orgasms that you personally experience, but from a medical or physiological experience, are there different types of orgasms?
So the orgasm is the act, the feeling of a buildup of tension and then a release, right?
Yes.
And so, but there are different origins of those orgasms, but the orgasm is essentially the same thing. So there's the clitoral orgasm, which is the most reliable way to achieve orgasm. So 85% of women need some clitoral stimulation to have an orgasm. And some of them will do it with penile penetration, but sometimes not. But 85% need their clitoris to be stimulated. So that's one. Then there's vaginal stimulation. So that's where you hear about the term the G-spot. And so that's in the anterior vaginal wall. So the top of the vagina, about 2 or 3 centimeters in, is where we have a structure called the Skene's gland. And
Skene's gland. And when you say it's 2 to 3 centimeters at the top, you're not talking about the end of the canal there.
No, so from the front. So your urethra is there, and then you put your finger in the vagina, and it's about 2 or 3 centimeters in.
And it's on the top.
Correct.
So if you put your finger in and you lift up, and this thing is real?
So it's a zone. It's not a spot. It's not a button, right?
Okay.
People think like it's this like magical button.
Tap. Stop doing that.
It's a zone where there is a whole bunch of nerves that converge. So there's obviously you have the clitoral bodies right above it. So there's erectile tissue there. There's nerves around there that converge. And there's also the Skene's glands, which is the homologue of the male prostate. So we call it the female prostate.
Okay.
And they also have nerves that are pleasurable when stimulated. So it's not this button, right, that you're going to press and women are automatically going to have an orgasm. But
everybody, did you hear that? Stop looking for the button and start massaging, for God's sakes, the area. Okay.
Yeah, but even then, some people will not orgasm from a G spot or G zone stimulation because not everyone finds that pleasurable, right? If I massage every man's prostate, he's not going to orgasm from it. It's not necessarily, I'm not massaging their penis, I'm massaging their prostate. It's the same thing. You're not massaging the clitoris, you're massaging the vaginal wall, right? And so some people find that pleasurable. Some people are able to orgasm with that. And there's a different nerve that sends a signal back up to the brain. So the perception of the orgasm may be a little different.
That's all the way at the end.
All the way at the top.
But isn't that also where you can experience some discomfort? Because if somebody's penetrating you and it's hitting the end and the cervix didn't lift sufficiently?
It's variable. Some women find it very pleasurable to have their cervix stimulated or around their cervix stimulated, whereas some find it painful. But some people do have cervical orgasms or orgasms from stimulation of the clitoris, let's say, and they will describe that differently, like shooting stars or like this like cosmic experience. And so you can have different types of orgasms. It's the same thing that's happening in your body, right? You're having a tension buildup and release, but it's from stimulating different parts of the body.
That's so interesting.
Yeah.
I don't know if I read this somewhere or if I heard this somewhere, but is it true that 10% of women are physically not able to have an orgasm?
So we know, 10 to 12%.
10 to 12%?
Have
That's not fair.
I know it's not fair, but we don't know if it's because they're not physically able or they're not getting enough stimulation to achieve orgasm. So this is because, so if you think about, I said the average time for sex, that really usually is time from male ejaculation, right? That's the time to ejaculate. But for women, the time to orgasm is different. So they've actually looked at this too. What is the average time to orgasm? So through sexual encounters, it's about 12 to 14 minutes. So many women, if you just have penis and vagina sex, are not going to orgasm, and they're not going to have an orgasm because they never got enough stimulation for a long enough time to achieve an orgasm.
So I got to ask a question. So when you talked about measuring the male orgasm, and I think the average was like 5.6 minutes or something like that. The way they measured that is somebody starts a timer and all of a sudden you insert, and from the time of insertion to the orgasm or the ejaculation, that's how we measure that.
Correct.
How do you do that? Like, when do you start the timer for a woman? Is it when the stimulation on the clitoris or the G-spot or the cervix starts, or how does that?
Yeah, I mean, I think it's variable, but, I don't remember exactly how they designed it in that study particularly, but ultimately, it depends on, probably requires, clitoral stimulation. I said the most reliable route. So probably from the beginning of clitoral stimulation to the end. But interestingly, when women masturbate, that time shortens. 8 minutes.
Well, no kidding. We know where to go.
Exactly.
Move this out of the way. Focus right here.
Right.
Yes.
Right. And sometimes you're just too polite to say, hey, you're doing this the wrong way. Like,
tilt your head in a different direction. Yes.
Exactly.
This is why we need to be on a walk with our partners, looking straight ahead. By the way, tilt your head towards 2:00 instead of 10:00. That would help. Dr. Rena, what is one thing that the person listening could do tonight to increase their chances of having an orgasm?
So the one thing you can do tonight is focus on the encounter. Don't think about the homework your kids have to do. Don't think about what you have to do for work tomorrow. Don't think about your to-do list that you are never going to get done, because we're never going to get done, right? Focus on being present and communicate, like actually talk to your partner, guide them along the way. And nonverbal communication works well too. So like sometimes we feel uncomfortable telling them, move your head to the 2:00, but you can gently move their head, right? There are things you can do, very gentle, very nudging, that can make you have an orgasm quicker, more efficiently, and in a more pleasurable way.